Sickle cell disease is a devastating disease with a very immense disease burden and also decreased life expectancy. And allogeneic stem cell transplantation is rapidly becoming a standard treatment for this devastating disease, also for adult patients with sickle cell disease. And while matched sibling donor transplantations with myeloablative conditioning regimens had resulted in excellent disease-free survival and also overall survival in children with sickle cell disease. However, the MEC, the myeloablative conditioning, was too toxic in adult patients with sickle cell disease. These adult patients have been developing accelerated cumulative damage of their vital organs due to ischemic damage, due to chronic inflammation and oxidative stress. There was a need for less toxic non-myeloablative conditioning regimens in adult patients. And in the last 2 decades, attempts have been made to develop these non-myeloablative conditioning regimens with some success. So improvements in supportive care and adaptation in the non-myeloablative conditioning regimens have resulted in lower rates of graft failure without causing increased toxicity. So that means that also adult patients with sickle cell disease can now be cured with mild conditioning regimens. But while the results of matched sibling donor transplantations are very good, these transplantations are limited by a small pool of eligible donors. So there is a need for alternative donors, and but again, some modifications in the conditioning regimens have led to increased rates of successful engraftments and acceptable rates of toxicity in haploidentical stem cell transplantations. So haploidentical stem cell transplantation with non-myeloablative conditioning regimen is also becoming a viable curative treatment option for many sickle cell patients with high disease burden and progressive organ complications, despite the standard treatments. So I think this is very exciting that now many more patients have treatment options with either matched sibling donor transplantation or haploidentical stem cell transplantation. There are, of course, some issues, especially with graft failure, but I hope in the near future we can resolve those issues and make this treatment available for many more patients in need of a meaningful treatment option.